billion.
Thanks, Sangeeta. Now, there's been a big rise in the number of people having plastic surgery in the UK. The number of men and women going under the knife rose by 17% last year. The figures show women are far more likely than men to have cosmetic procedures, making up 91% of the total. But they're most likely to have breast implants, while the most popular procedures for men are nose jobs. And the biggest overall rise was in the number of people having liposuction, up by 41%. Well, I'm joined now by the model Alicia Duval and Alex Karidis, who is a plastic surgeon. Great to have you both on the show tonight. Alex, if I come to you first, are you surprised by these figures?
Well, no, obviously I'm aware of the popularity of plastic surgery, and I think obviously these figures do underline this. However, I think we need to put it into some perspective, because obviously the last 3-4 years have been pretty tough, generally speaking, with the economy, and I think that in these situations, people put off things like plastic surgery because they're not non-essential items. And I think now that the economy seems to be picking up a little bit, people are saying, well, you know what, I want to treat myself. And so therefore they're seeking some enhancements. Interesting
that more and more men are having procedures.
I think men, yeah. I think they're a bit slow on the uptake, but in general, I think men are becoming more aware. Certainly, there's a lot of information out there on the internet now, and so they're reading up on things and they're understanding what could be done for them.
Well, Alicia, you have very famously spoken out about the number of procedures you've had and the money you've spent. I think, is it over £1 million of work you have had done? Do you feel happy, having spent all that money on all those procedures? Are you now happy when you look in the mirror?
No, not at all. I think it was a waste of money and I was misinformed.
So when you hear these figures of more and more people having plastic surgery, is it with a sense of dread you read this?
Yeah, I'm very saddened by these figures because, I mean, obviously there's a lot more people out there like me who are naive, trust the doctor and think that, you know, these surgeons can change their lives, when actually I think a lot of them are like me, where they're disappointed with the results.
Well, Alex, it is quite a responsibility, isn't it? Like Alicia said, she thought that someone like yourself could change her life. I mean, do you feel a moral responsibility when a patient comes to you and talks about the procedures that they want?
Of course, we do have a responsibility, and of course living, sort of trying to realise patients' expectations is always our hardest job as surgeons that we have to deal with. We obviously have to try to assess each individual depending on their needs, what they want, and see whether what they're asking for is realistic. Because, you know, if we sort of sense that they're doing this to change some aspect of their life, it's clearly not going to do that, and so we have a responsibility to explain to them, you know what, it's not going to do anything of what you think is going to do. So.
And Alicia, did you feel that you got that advice when you were having all your work done?
I think surgeons say the right things, but at the end of the day, they're thinking about their children's school fees, and where you've got a billion-dollar industry, you've got greed.
Is that fair? Is that fair? It is a regulated industry, after all.
I don't think. Obviously, Alicia's had you know, an experience which you know.
Not a.
Yeah, yeah. The whole thing has been an experience, obviously, for her, which stands by it. But I don't think we can generalise. And many people don't go down this route in terms of having multiple procedures, as Alicia had. The vast majority of people have only just one procedure, maybe, you know. And the other thing we have to realise is there's differentiation in cosmetic surgery. There's one aspect of it where you do something to change your appearance, and of course the other thing is to rejuvenate yourself because of aging, because of the ravages of time, pregnancy, weight changes. So there's many aspects of it, so it's not just sort of black and white.
Okay, well obviously your industry was kind of brought into some kind of disrepute last year over the PIP breast implants. Now in January of this year, I think you now have to register every single breast implant operation that takes place. Do you want to see further regulation?
Absolutely, we welcome this, because I mean, for far too long it's been unregulated. Unfortunately, there's a lot of red tape that's just not allowing it to become regulated, and certainly when we hear anything like this, I think most reputable plastic surgeons would agree with it.
Okay, Alex and Alicia, many thanks indeed for your thoughts tonight. Thank you. Well, coming up on News Talk Live, we look back on a decade of Facebook and ask if you like it. We'll see you for that after the break. Don't go away.